Thanks for coming out on a beautiful spring day. It's kind of surprising you'd have to brave the weather to come here, but glad that many of you did. And let me introduce our panel, and then I've got just a couple of slides here to set the stage for our discussion, and then I'll turn it over to some questions for our panelists. I'll start on the far end there. Dr. Gerald Harriman is a physician who joined Harbor Hospice in 2006. Prior to this time, he was a board-certified family physician and in private practice for over 21 years. He's a 1985 graduate of Michigan State University College of Osteopathic Medicine, where he continues as an assistant professor in the Department of Family and Community Medicine. Dr. Harriman is certified in hospice and palliative medicine and was so in the inaugural year of 2009 and serves as the medical director for Harbor Hospice and Palliative Care and for Mercy Muskegon Inpatient Palliative Care Program. So thank you for being here. Robin Anderson is a nurse practitioner in palliative care at Mercy Health and Harbor Hospice in Muskegon. She sees patients in an acute care hospital setting, the Poppin Residence House for Hospice, and in home hospice care. She's received degrees from New York University, the University of Phoenix, Texas Women's College, and her proudest degree is from Muskegon Community College. So, just think, in a few years, you might be sitting where she is. So, Luke Reynolds is the executive director of LifeCircles PACE that provides all-inclusive care for elderly, including health clinic services, in-home services, a day center, and more, with the goal of keeping seniors in their homes as long as possible. Luke is also co-chair of Charted Healthcare Planning Coalition that is co-sponsoring this event. So thank you all for being here. I'll turn to questions to our panel, but I just wanted to start off talking just a little bit about National Healthcare Decisions Day. It exists to inspire, educate, and empower the public and providers about the importance of advanced care planning. So I hope we do that. I hope we inspire and educate and all of those things. So what is advanced care planning? Advanced care planning is a process of making decisions about the care you would want to receive if you become unable to make or to speak for yourself. So it's a process. Part of that process is an advance directive, which is a document that states who you want to make decisions for you when you're unable and what care you'd like to receive. So a lot of you, I noticed, picked up those as you came in, and if you didn't get a chance to do that, there'll be a chance at break to do that as well. What is Charted? Charted Healthcare Planning Coalition. Luke might have more to say about it, but Charted Healthcare Planning Coalition consists of multiple community and healthcare organizations whose goal is to educate, create awareness, and give tools to the community regarding advanced care planning. The goal is for every member of the Lakeshore community, make sure every member of the healthcare community, Lakeshore community, has a plan for their healthcare needs. I put the members up. You can read through of Charted. If you're part of a group that isn't on that list, talk to us. We're looking to expand, I'm sure. As you can see, Muskegon Community College is one of them, but as well, we've got Mercy Health, Hospice, Hackley Community Care, Senior Resources, LifeCircles PACE, so many different groups on there. And I want to point out, we have a website. And that's what it looks like. Our website is right there. It has all kinds of things for your needs. If you have questions, If you need advanced care planning documents, if you need Advance Directive, you can download it right here. If you've got questions, there's even a place to contact us and to ask questions. And I want to stress also, a lot of times people say, I don't want to fill this out because I don't want to pay. Well, it's free. It's free. So feel free to contact us. Again, if you have questions, it doesn't cost anything. And filling out the documents and filing them are free. So with that little preamble, let me turn it over to our great panelists. Why don't I start with Dr. Harriman? Why is advanced care planning important? Why do you see it as something we need to think about?
Good evening. Advanced care planning is very important. It's important for everybody. And most of the time we think of people who are sick, they're in the hospital, or they're elderly, or facing some crisis, and then it becomes a major point. And it would be much better if, as adults, we took the time to review what our plans are so that when we face situations where decisions need to be made for us, that we've outlined what those are, you've identified who that person is, who's going to make those decisions for you, and make sure what your choices have been outlined specifically will be followed. So that's what I would say.
All right. Robin, what is the process one goes through to create an advanced directive and think about advanced care planning?
The first thing you have to do is just start thinking for yourself as far as what is important to you, what to you do you consider quality of life, because you have to first know what that is before you can communicate that. And then the next step is to start to communicate that to those closest to you, including your primary care provider. You know, you can have a plan, but if you don't share it with anybody, it's not any good. You have to have discussions. And understanding, too, that at different points in your life, that may change, and that's okay. But you have to, so it has to be like an ongoing discussion about what your wishes are or what's important to you at that time in your life. You take somebody who's maybe pretty young and you say, if you were in an accident and you could no longer walk, is that okay for you? Is that a quality of life you'd want? And there might be some people who say, no, that's not important to me. But maybe once you were in that wheelchair, you say, you know, this isn't so bad. I just, if I get to the point where I can't move around on my own, then that wouldn't be okay. So you understand, and especially in this day and age when we have so many chronic disease processes that we're very good at managing nowadays, so people are living a lot longer with them, that those things change throughout time of what they feel is an acceptable quality of life to them. So it's a living, breathing thing. It's not a one-time thing. Certainly putting that documentation down as far as which person you trust to make those decisions for you, but that can also change. So it's always good to think about that.
Luke, do you want to say why you got involved with Charted and maybe a little history of it and your interest?
Sure, thanks. To piggyback a little bit on Dr. Harriman and Robin too, I look at an advanced care plan as a gift that you can provide your family or your loved ones. I've seen, and most of us in healthcare have seen, too many unfortunate situations when family members are forced to make decisions on behalf of their loved ones when they don't know really what the person would have wanted. They've never had the conversations. They never thought they'd be in the position to have to do this. And so just like we try to make sure that we have insurance to help our loved ones, this is kind of an insurance for them and an insurance for you to make sure that your priorities and preferences are honored and respected. We can almost keep people alive at all costs now, and sometimes it's at the detriment of quality of life and what a person would really want. So I'm a clinical social worker. I've done a lot of work over the years in healthcare and in behavioral health. And kind of what I just said was the reason that I took an interest in this. And when I began working at LifeCircles, I recognize that the average age of the people that come to our service is 78 years old, and everyone we serve is frail. They all meet the state-defined nursing home level of care criteria. So most of them are at the latter stage of their life on earth. And too many of them would come into our care having never had conversations with loved ones. Some of them had already started having dementia and were already past the point where they could make a truly informed and logical decision. So I saw family members struggle with simple things like, would they have wanted to be placed in a nursing home? Would have wanted a feeding tube? Would they want to have IVs? I mean, these questions that when you're healthy and your mind's working, they're pretty easy to answer. So the coalition was made up of a bunch of passionate individuals in the Lakeshore community. Some of them worked for nonprofit organizations or health systems. Others were just passionate about the cause, and we started to try to figure out a way to help the community understand what an advanced care plan is and how to have the conversation. So there are people in this community that have been specifically trained to help guide conversations. These are not easy conversations to have, and most of us feel uncomfortable having them. And so these trained facilitators are available and willing and able to help guide the conversation so that you can produce a plan so that the plan can be followed when and if you're not able to communicate on your own.
Right. Good. Thank you. One reason my interest in this subject is, well, I teach biomedical ethics, but also I remember my grandmother had Alzheimer's disease, and I remember my mother giving her the Advance Directive that my mother pretty much filled out, and then said, here, you need to sign this. And she goes, what am I signing? She goes, it's what your lawyer, Mr. So-and-so, oh, he's a nice man. I said, yes, he is. So could you sign this? And she signed it. I was like, I was kind of young. I thought, this didn't quite seem right, the best way to handle this issue. So that's how it was handled. And I asked my parents even today, have you talked to my brother? Well, we just haven't quite found the right time. I said, it would really help if you talk to my brother, because I have a feeling we don't see eye to eye, and if we could all get together, yeah, we'll do that next holiday. So if you can, it's hard, even when I'm supposed to be quite knowledgeable on the subject, to even have your family do it.
Can I just
yes,
make
go
a
ahead.
comment? Just looking around the room right now, I see many of you are not past the 50 mark. So you're probably sitting here thinking, what does this have to do with me? Why is it important for me personally? You probably think of your grandparents or parents, and that's who you're thinking this for. But I want you to really think about it personally. If you look at the national big things that have happened that got in the news, it was two young people that started a lot of this. Some of the Karen Ann Quinlan was the first one back in the 70s, and she was 21 years old. She had a major event happen. She went into a coma and then into a persistent vegetative state. Her parents decided they wanted to take her off the ventilator. That's not what they felt was good for her. The doctors at the hospital refused to do so because the prosecutors in that county were saying, if you do that, we're going to charge you with murder. So her parents had to go to court to ask to get their daughter to be taken off the ventilator. Well, through many things that happened, they finally were granted the right to make decisions for their daughter. They didn't want to stop the feeding tube. They just wanted to be able to take her off the ventilator. They took her off the ventilator. She lived for 9 more years, breathed on her own, okay? And then the other case that more of you might be more familiar with is Terry Schiavo, okay, in Florida. Would you want our state legislature or our governor to make those healthcare decisions for you? Okay. Again, it wasn't clear, so the husband and the parents were having a disagreement on what they felt should be done, and that went into state legislature. And I personally do not want politicians making any decisions about my healthcare choices. So again, for your own peace of mind about what you want for yourself, it's important for you to start thinking about that.
That's to take off of what was nicely said by Robin there. Dr. Harriman, how has healthcare planning changed over the years? How have you seen it change?
I don't think it's changed a great deal, except the forms are trying to be more specific. Sometimes these documents that are pre-printed and you check a box next to it, sometimes the wording there is kind of vague and not clear-cut. So I encourage people to cross things out, write on them, or there are some places like in the 5 Wishes booklet, which is commonly used, there are spaces to write out how you would want it in your own words, so you don't have to use the pre-printed. But other than that, you know, what we hope would change is that it'd be more people would be doing them. You know, this a similar group a number of years ago surveyed the county and found that under 30% of the adults had an advance directive completed. And then they repeated the survey 10 or so years later, and it was the same percentage. So it hadn't increased in that amount of time, and I think that's some of the motivation behind the charted group was that kind of statistic. It's like, well, this is just not good. So we need to make it more aware. So you need to have events like this, or at your doctor's office, you know, Medicare, which again doesn't apply to 90% of you or more, you know, covers advanced care planning to have these kind of discussions with your doctors. So they actually are, it's a reimbursable visit for them to go over this with their patients. So I think that's one item that's changed. As far as what's contained in it, I think is pretty much stayed about the same. You need to identify someone who's going to make decisions for you. They agree to it, you have witnesses, and then the additional information is what you want in different scenarios. Some of them I've seen are, they can be vague, but then you can't come up with every single scenario of what could happen to somebody. I mean, how many different situations can come up? Lots of them. So, you know, so there needs to be some principle or, you know, thought process behind what you want to say so that it can be applied to the setting. I think of advance directives are, like Luke mentioned, it's kind of a gift, and I think it's a gift back to the family in the sense that it takes the pressure off of them. It can, I have my top 10 list here. Top 10 reasons for why you need to do advanced care planning in the spirit of David Letterman. Number 10, it helps your attorney. So we go to the attorney and you can do that. I hope there's no attorneys in the room, but we're not being recorded in, right? No, we're not. Number 9, it resolves conflict. We've all seen this, and it was referred to by Andy there a bit, that not everybody agrees. So if you get your wishes out there, then it takes care of that. It leads to better care. There are some medical research that shows those patients with advanced care plans have better outcomes and better care than if they don't. It can serve, number 7, it serves as a conversation starter, so it can be something like one event they had a few years ago was Talk Turkey, and that was around Thanksgiving time to motivate people to talk with their families when they get together. Number 6, sets an example. You can be an example for the rest of your family. You know, one person kind of breaks the ice, and then everybody else may be more willing to communicate or talk about those concerns. Number 5, gives clear direction. Again, you can have it spelled out the way you want it so that it's very, very clear. Number 4, burden relief. It relieves the burden off your family so that the other kind of a gift that it is you're giving a gift back to the person who completed it. So when they've made their choices, you're making sure that what they get is the type of care that they've planned and have wanted, or they don't get what they don't want. So, so it relieves burden for the family. Number 3, you get treatment the way you want it. You can design it so that it specifically spells out if you want antibiotics, or you don't want a ventilator, or if you don't want a tube feeding, or if you want this much time before withdrawing life-sustaining therapies. Number 2, makes sure you get the kind of care the way you want it. And I think that's very important. And then number 1, is peace of mind. And it's peace of mind for you, and it's peace of mind for everybody else. And I think I snuck that in there on your question. Sorry about that.
That's good. Good.
But I think the thing that needs to change is that it needs to be more common. That's what I think. And I think the items that are contained in it, within it are about the same as what they've always been. I think the documents are getting better. We have another one that is being disseminated now more regionally, developed by health systems, that is maybe a bit better than the 5 Wishes booklet. But I think it's important that you take a look at it, take your time. Like Robin said, think it through first and then write it all out. Maybe you can't do it all at once. Maybe you can only do part of it at once. Talk to the people who you want to be your decision maker. It's very, very important. It's not always the spouse. I've seen that on a number of occasions where they don't want their spouse because they don't think their spouse will do what they want. Or it may not be their children. It may be somebody else. It may be a friend of the family, or maybe not a son or daughter, but maybe a niece or a nephew or somebody like that. So,
Robin, I wanted to ask, let's say my parents, to use my family again, I was trying to get them to do an advance directive, and for years couldn't, because the only time they heard about it was when one of them was going in for surgery or something, and they're like, I don't want to think about that now, I want positive thoughts going in, and so they didn't do it. And then finally they did, and then I asked them where it was, and they said, and my mother said, to my father, don't you have that in our files? I said, yeah, I'll go get that. And about a half an hour later, he came back with it.
That's pretty good, actually.
Probably.
Because many people put them in their safety deposit box or something like that where nobody has access to them, which is not what it's supposed to be for. If you do get to the point where you get one completed, you need to share it. You need to share it with those people who are closest to you. You need to share it with your primary care provider. And again, it should be a living, breathing document. It should be something that is periodically reviewed. I really would love to see it at your annual physical every year, that's part of the discussion that happens is, we bring it out, we look at it, say, are there any changes you want to it? Is it still what you think? Those kinds of things. So it shouldn't be a document that's done and then completed and filed away and not ever looked at again.
And with electronic medical records, it should be easier to be a part of your record.
And we're working on that both within our healthcare systems and even at like the state level, to be able to have a bank where these can be put into, so that if something were to happen to you and you were in an accident, not next door but across the state or whatever, that document can be accessed and pulled up, so that first of all you know who you're supposed to talk to and what your wishes are.
All right, thanks. Maybe I don't know who wants to answer this, but a lot of times people think people with advance directives might they're kind of giving up, they're living shorter lives. Is that the case, that if you fill out an advance directive, you're kind of giving up?
yeah, it's a curse. If you fill one out, you're guaranteed to die within 72 hours. So, people think it's kind of morbid, it's like, well, I don't want to talk about this. It's a family time, it's Thanksgiving, it's Christmas, it's, but we don't get together at other times. So, it doesn't make you die any faster or earlier. In fact, it might make you live longer if you don't get the kind of care that ends up harming you more than benefiting you.
And actually, I think there are some studies that have shown that people who have completion like this, their quality of life indicators go up, because just the peace of mind they have that document completed and they've had those discussions with people make a difference.
Maybe Luke, I want to ask you, Dr. Harriman said that there's less than 30% in our community have an advance directive. Are there other places in the country where that's different?
Sure, there is. La Crosse, Wisconsin is the mecca. Yeah, it's like advanced care planning utopia. Their whole community I think they boast 98% or some crazy number of adults all have an advanced care plan. And not only do they have the plan, but it's actually part of their health system. So wherever they go within their health system, whether it's a specialist office or the ER or the hospital, that document is actually used by all the providers for decision making. And there's all kinds of evidence-based practices that go into that, and it's a community model. They use a framework called respecting choices, and that's where people actually, providers and other professionals, use specific techniques to have conversations. One thing I like to try to remind people, and most of you are college students, right now you're using critical thinking a whole lot. Unfortunately, after college, sometimes the ability to use critical thinking skills starts to go down. So I'm going to challenge you all to just always use your critical thinking skills. Unfortunately, some of our healthcare system approaches an advance directive as a checkbox document. Let's fill it out, let's be done with it, and let's store it and file it. It's really much more than that. We keep talking about the document, but it's about having real conversations about what's meaningful to you, what gives your life purpose, and what matters most. And until those kinds of questions are figured out and worked through, you can't really produce a real, what I would call, valid document. And obviously, like Robin talked about, it's dynamic. It's going to change as you change, as your life progresses. So.
All right. Dr. Harriman, you mentioned that these documents sometimes can be a little vague. As a provider, is it still helpful for you even if they are vague? And for obviously the person making the decision, the family member or spouse, whoever it may be, is it still helpful to have some general values? I know in my grandmother's case it was, I never want to be a burden to anyone. Well, I don't know what that means, but it was still helpful to know that.
They're still helpful. It's just that you need to have more conversation with the family or who's making the decision. So if, like you say, something vague like your statement, then you'd need to talk to the family and say, well, you know them better than I do. What would they have wanted? What would be consistent with either something they've said before out loud to you, or have it written down somewhere else, if you know, or what would be consistent with how they would want the kind of care that you're talking about that's, you know, serious. So you hope that you can gain some principle behind the statements that are in there if there's nothing specific. Some people make it very clear and they say, well, whatever it is, I never want a feeding tube. I never want to be on a breathing machine. I never want, you know, those are very specific, although there are different scenarios where they might want it. And that's what makes it difficult, is because we come up with 1,000 different reasons why somebody might be facing a complication from a surgery or just a chronic health condition or an accident or a tragedy or something like that. So having something is better than nothing. At least you have a document that says who I can go to and talk to, and has the authority recognized by the state of Michigan to make your decisions for you legally. Every state does them differently. You know, there's some similar documents between all the states, but they all don't recognize them the same always. Living wills, no one's mentioned the word living will tonight, but that term actually in the state of Michigan is not recognized as a legal document. It's okay to have one specifically drawn up, because usually in those kind of documents it's outlined what people want as opposed to saying who it might be or something like that. So they're not, you can bring them in and they can be read. I'm thinking maybe in the hospital, in the ICU, and you know, grandma's on a ventilator and someone says, well, she never wanted that, and someone says, well, yes, she did, and you know, you get those kind of back and forths. So sometimes in there may be something that would give something. No one's required to follow it because it's not officially legally recognized in the state of Michigan, but as physicians and healthcare staff at the hospital, for example, they would at least look at it and get some sense of direction that could be used from it, but they're not held to it. And a properly advanced directive, and it's important that they, I think one thing about, I was poking fun at the lawyers, right, in that, the top 10, but really the part about going there is that you do make sure that it is properly done, because a number of them we see, and I don't know what percentage, it's, I don't know how many it is, but they're not complete, they're not proper. They're missing signatures, the wrong people signed it, so, which violates, and then, it's not a legal document unless it's proper. So by going to an attorney, at least you have it specifically. There are other trained people who can help you, like Luke was referring to. Trained facilitators for these can help you make sure you're dotting your I's and crossing your T's, because it is critical for this kind of thing.
Yeah, if you do contact Charted, we can get you in contact with a facilitator who does know the legalese behind the documents to make sure all those parts are properly filled out.
Yeah, in Michigan, it's the durable power of attorney for healthcare or patient advocate, and that's what it is. So it lies more on having that discussion with the people that you would choose to make those decisions for you. So that's why we stress the conversations, because quite honestly, if you choose somebody who doesn't really know what you want, or knows what you want but doesn't agree with you, they make the choices, okay? So if you say, don't put a feeding tube in me, I don't want it, and that person says, well, I want them to have it because I'm not ready to not do that to them. So again, it goes back to that. It's very important to choose the right person, and that takes discussion. That takes talking to people. You think you know what your brother, sister, mom, dad, spouse thinks of something, but until you start having that discussion, people have told me, I never knew that you thought that way. So it's a process. It's not a one-time do thing. It's really a process.
Right. In Michigan, just to support what you're saying, it is only your proxy or the patient advocate that will make decisions for you. Your identification of that person is the only legally binding thing. Now, you might say, I don't want to be put on a vent. Well, the person says, I'm putting you on one. Well, you shouldn't have chose that person, for one thing. Now, legally, they can challenge it to say, hey, you're not looking after the best interests of that person, but it'd be a real messy process that you probably wouldn't want to go through. So who you pick is so important.
Yeah, and the only thing I wanted to emphasize, if you are having a conversation with someone and they say, I don't want to be a burden, it's really, that's what these trained facilitators are trained to do. They would say, okay, what does a burden mean to you? And so it's actually broken down. And as someone that is selected to be a durable power of attorney for someone, it's really important for you to understand exactly what they mean and question it. I've seen patients who their loved ones actually heard from their mouth what their preferences are. It's much easier for the family members to follow, or their decision makers to follow. If they've only seen it in writing, it may not carry the same amount of weight. So back to Robin's urging, it's really about the conversation.
Yeah. Okay. I wonder if Robin or Dr. Harriman can talk about, sometimes there's not a lot of, sometimes we trust physicians and medical team a lot, but sometimes there's distrust that maybe they don't want me alive, or they're not looking after my interests. How does Advance Directive help improve trust with the medical community as well as with loved ones?
Well, it certainly gives them, as healthcare providers, we're looking to do what they want also. We're, we all come with our own set of beliefs, our own set of things, and so it's hard at any point to not project that onto someone else. So when we have a guideline, when we have something that tells us what they want, it's much easier for us as healthcare providers also to feel comfortable in what we're doing for that person. We've gotten so good at keeping people alive. Okay? What I tell people all the time is, you know, there's always something in medicine we can do to you. What I can't promise you is that it'll make things any better. So you have to take it in the context of where they are in their disease process, what are the chances of them having any meaningful recovery. So for us, for healthcare people, to me, it's a no-brainer. It helps me tremendously.
Is that what you're talking about, the trust? How does the patient or the person or the family trust the healthcare workers? Is that your question? Well, that's why it's important to choose the right advocate. I mean, they will make sure they're going to do what you want them to do. And so it's got to be somebody who's strong, willing to follow what your wishes are, and making sure. We all need advocates, you know. The system is so complex, complicated, so many different providers now. If you've been a patient in the hospital recently, you know, you see 16 different people all in the same day. You have no idea who they are, who's come, you know, looks like a doctor, maybe it's not a doctor. Is that a nurse? Is that not a nurse? They all have scrubs, wear jackets, similar badges. What does that mean? What's that title mean? I don't know who to trust. For me, you know, it's someone who has confidence. I trust someone who comes in to if I was a patient in a room, and I know that they have my best interest. And you have a sense, right? Don't you have a sense of people when they walk in and how they are and how they interact with you? And so as you're learning how to trust them, they're learning how to trust you, and you know, so it's kind of a back and forth scenario. But having a document as a result of your conversation makes it so that, you know, you trust everybody. I mean, it's your set of rules. It's your game, your rules.
Well, and as a healthcare provider, if you walk in the room and you have that document, you could say, I see that you've completed this and you've said this in the past, and if we, you know, go this way, this is where. And that, again, then allows better trust because they feel like you're actually paying attention to what they've asked for and what they want. And it's not just about doing the medical procedures, because many times that's what we've heard from older patients in the past, is that they just want to do stuff to me to get the money.
I'll go ahead. If
You know, when people trust somebody is when someone you know has listened to you. You know that they've heard what you're saying. You naturally trust somebody like that. And that's why having a conversation, it's nice to have it spelled out at home. You finish your document, you bring it into your doctor's office or the hospital, and then talk to them about it. Then you know that, you know, if you have their attention and they're listening to you, then you know you can trust them. You know, they're paying attention to what you're saying and what you believe and what you want. That's where it makes a difference.
Thanks. Are there questions that any of you have? Please feel free to raise your hand for the panel. I can ask questions.
What if it's notarized? Does that mean anything?
No. Notarizing it does not make it legal. Yep. None of these have to be notarized. The durable power of attorney for health care, or whatever you want to call it, does not require notarizing.
I think some states require you to notarize, but Michigan does not.
Yeah, I can only speak for Michigan. I don't know otherwise. It's hard enough to keep up with one state of confusion than it is all of them.
In Michigan, the requirement is that once you sign that document, that you have two witnesses to your signature. Basically what they're witnessing is that you're signing it of your own free will, that you're doing. It doesn't really have to you don't have to have the discussion with them about everything you want or don't want. It's all they're witnessing is that you are signing it of his free will.
That it's you signing it freely.
Which is probably better than, as mentioned with my grandmother, my mother kind of, here, sign this, and then she went and had it notarized. But that was in another state. So. Other questions?
So if you move to a different state, you need to make sure you
Right.
use the paperwork from
Right, right.
That's right. You have to update it for a different state.
Right.
Correct.
Right, and that's true for like snowbirds and stuff like that, if you live in kind of two different states. So, question here.
So if you don't have one of these in place, does that automatically go to your spouse, or does that go, who does it go to?
There isn't a there isn't a, there, usually it's the spouse and parents and that kind of stuff, but really in Michigan, there isn't a hierarchy. So we generally try and get a consensus of the family of, or the people who are involved in it. And if you have two fractions that are really polar opposites and fighting, it becomes a huge problem. Most of the time, families can get together and come to an understanding after a period of time, but there are those families who really have, you know, two sets that are completely, and that's a mess. And it puts us in the middle of it.
And the patient has to endure whatever they're enduring, you know. This happens in crisis mode, right? This is not something that's planned when it comes out like what you're talking about. This is crisis time, so it's in the ICU, somebody's on a ventilator, they're not doing well, they've had a heart attack, you know, whatever the scenario is, and it's now the patient, you know, it's not just we're waiting for the car to get fixed, you know, it's sitting in a parking lot, it's just, you know, this is someone who's enduring some sort of intervention and aggressive medical care that's maybe not the best for that person, for whatever those reasons might be. So it can be, that can take a while to sort that out. Days, sometimes longer. And in the meantime, there's someone, you know, getting that kind of care that's maybe not of their best interest. So your answer, the answer is there isn't a set hierarchy. I mean, it's commonly done that way. You know, like you look to the spouse if they're married or they're not married. You know, parents or brothers or sisters or something like this. But we do tend to rely on we have to rely on the consensus. That's what it is. You ask for one person to be a spokesperson and then try to do it. There are scenarios where you can try to get an emergency guardian. That takes time. That is. We say emergency to the court. That's, you know, emergency doesn't. There's no such thing. So it takes weeks sometimes.
And just so you know too, if you have an advance directive completed and it's your spouse and then you divorce them, we're finding that a lot of ex-spouses do get back together and live together, and they say, "Oh, I want him to be." You have to redo your advance directive if you want that person, because if it was done before the divorce, that person, that's null and void. You have to redo another one. Doesn't mean that ex-spouse can't be your decision maker if you really feel that they could do that for you, but you just have to redo it.
Mary Ann?
Just wonder if Jerry and Robin, if you could describe from your own practice, you know, an example of where the fact that a patient did have an advance directive made a big difference in how their end-of-life care, or even if it's not end-of-life, if it was an advanced chronic disease, how, in your experience, it was helpful to them.
On more than one occasion, I've seen sort of what we've alluded to earlier, and that was it just creates a lot of peace in the family and lack of turmoil. Sometimes we see family members who will disagree even when there is an advance directive that's been completed, it's legal, it's all there, everybody's seen it, we've read it, we're following it, and still there's somebody else who disagrees. And the one who's making the decision then has the peace of mind to know, like, well, this is what mom said, or whoever. I've had a number, you know, patients and the families who come up and say, you know, that they're glad that they've had this completed so that it does take that pressure off and they don't feel the burden of, it's up to me. I'm the one who's going to, quote, pull the plug, end of quote. So, peace of mind, hopefully reduces stress, distress within the family or other people who are coming in and wanting to stir up the pot. Sometimes that happens. Family members who've been estranged come into town during the crisis, and they haven't been a part of anything for a long time, and now they want to voice their opinion and make sure it's the way they want it to be for mom or dad or grandma, grandpa, or whatever. So it, more than once, it's been, very clear that having that has made a world of difference for the family and reduces that, like I said, stress. It gives them the sense that they're doing the right thing. People want to do the right thing generally. There are some who don't. We know who they are, but most people want to do the right thing, especially when it's someone you care about. People want to do that.
So if they have that guideline, that makes them feel much more comfortable with making those decisions. It still doesn't make it easy. Don't get me wrong, these are not easy times. It's not easy decisions when you've got somebody, in the hospital or who's dramatically changing in their health care. It's always difficult, and it's very emotional. And that's why it's important to have these discussions and put this stuff in place before it gets to that point. Because we know when we're under stress, when we're under those kinds of things, our reasoning, our ability to really think logically through things is not very good, okay? So if you can fall back to that and say, I'm feeling like this, I feel like I need to do something, but Dad always said, and he wrote it down, this is not what he wants. So although I'm feeling this, I know that I'm making the right choice because we had these discussions at a different time when it was calm.
I remember just being on the hospital ethics committee, and a case came, and two different family members were just fighting amongst one another of what to do. And someone on the ethics committee said, well, what would your mother want? And they both agreed she wouldn't want to be cared for like this anymore. And then I was like, oh, I guess we solved the problem right there. And we didn't really have to say anything, but they didn't have an advance directive, but at least they had had that conversation and they'd all heard it. And it just problem solved. It was great.
Well, and I was just going to say, none of us have truly functional families. They're all various levels of dysfunction, and nothing brings up dysfunction more than a medical crisis. So, you do see situations where people are rushing in and trying to make up for lost time, or they have regrets and they can't reconcile those regrets. And so that stuff all comes bubbling up and it gets very messy, which again is why if you have these conversations in advance, it just makes everything a lot easier.
I think we have time for one more question.
How often should these be updated?
We would love to see them done, again, annually at your physical, but anytime you have certainly a change going on, a healthcare crisis or something change, it's always good to review and look and see, is this still what I want? But for me, I think at least annually is a good rule of thumb, just to look at.
So, does anyone want to add? I assume if you're diagnosed with an illness, or if, as you said, get divorced, or these life-changing
Right.
things would be
Right,
definitely a time to do
right,
Move to a different state.
yeah.
it. Oh, yeah.
All those things, yeah. Make sure it's legal in the state that you move to, yeah.
Anything else? I guess that was pretty quick.
And just again, remembering, I know that in our society, we're so afraid of the end of our life. When we avoid it, when we don't have the discussions, we're all about control. We're all about autonomy. We're all about me and that what I get, what I need, right? But if we don't have these discussions, if we don't talk about what we want for ourselves, we lose that control. It's gone. It's out of our hands. Somebody else is going to make those decisions at some point, whether you had input in it or not. And it will happen to every single one of us. And I have to tell you from experience, I'm from a family of 8 children. Okay? I'm the only medical person in my family. They call me the angel of death because I'm very open about these things, and also I make them talk about it. So in my family, to begin with, it was a difficult thing, but now it's not. It's just a given. And whenever we have something happen in our lives, we talk about it again. It's the first conversations that are the most difficult. Once you get it going, it's not.
I think, want to thank the panel for a wonderful job.